Well, hey everybody, good morning. Therapist Jen here, coming from my porch. It's a fabulous morning. Reflecting a little bit today, I was thinking of those of you out there that might be taking psychotropic medications and you're looking to decrease and get off of that shit. I am on the same journey right now, doing the same damn thing for myself. And I had someone reach out to me recently and tell me that I was tenacious and I was trying to apply that to my life. And so I'd like you to do the same. What things are you really, really persistent on and determined in? For me, it's to get off of my Lexapro. I've been talking about this for months now on social media, and I'm at a space now where I have finally started to decrease my dosage of my Lexapro. And I want to talk about that really quick. For me, this is taking a ton of tenacity because I'm very determined. I'm going to persevere for this, and I know it's going to take a very long time because I have been on that shit for 20 years. As a therapist, I also help my clients out with some holistic interventions that include neurohealth and looking at their amino acids, looking at neurotransmitters and how that's really impacting how they feel. I'm doing the same thing myself. So not only can I speak to other people about it in terms of the generalities and the science behind it, but I can say I am doing it too, and this is exactly what I experience, which is pretty cool. Again, I'm determined. I'm going to persevere. I'm very tenacious on this one. I want to show you something that I saw recently on TikTok. I can't duet this. I can't stitch it. So I'm going to throw it in the background so you can take a look at it and then come back. All right. I'm going to green screen this. Can you guys see this here? Look at this. So this is an individual saying that effects are as hell coming off of. And I don't disagree at all. I've never taken it. But all my clients that haven't tried to come off of it, it's very difficult for them. And here's a doctor, and she is saying that if you're taking that, this is how she does the taper. 150 milligrams, and then she's going to right away have someone taper down to 75 for 2 weeks. Now, if you go follow this individual, she does a great job of explaining the taper and how she tries to follow up with the clients every 4 to 6 weeks to make sure that they're doing okay. I'm going to tell you right now, for most people, including myself, including multiple clients I have right now, that taper plan doesn't work. Now let's talk about maybe why it doesn't work. I personally have tried that multiple times over the last 20 years. My providers that I have seen, bless their hearts, because I've had a couple that have been really, really good, have given me that same advice. Okay, here's what we're going to do. We're going to cut your Lexapro in half. You're going to try that for 2 weeks. Then we're going to take it down another quarter or even another half, and then try that for 2 weeks. So really my taper plan was, let's see, you've been on this med for years and years and years, and within a month or so, you're off. That shit don't work. Here's where my tenacity comes back. When I would get off of my medications and start to taper down on my Lexapro, I would have significant withdrawal effects. And why are we not calling withdrawal anymore? Discontinuation syndrome is withdrawal. It's when you have a physiological dependence on something. That's all there is to it. So can we call it withdrawal? Because that's what it is. The reason that taper plan often does not work for people and didn't work for myself is because you start to get symptoms that come in hot and heavy. Those symptoms are very, very reflective of the original reason you went on the med in the first place. So you're actually withdrawing from the drug. But what happens? You think the symptoms are coming back. For myself personally, my mood started to decrease again. I would start to get irritable. I would have fatigue, terrible fatigue. Even some shaky kind of things going on, which didn't make sense to me at the time, but now does. I would start to just feel low. And I thought, here we go, depression's back. And so what happened? I couldn't get off of my medications. I went right back on them and said, well, I guess you can't do it. I guess you're not ready to do it. I guess your body can't handle it, which is BS because I could have. But what happened is that I was given a taper plan that my body couldn't handle. Here's the other thing. Nobody explained this to me either. My providers didn't sit down with me and go, you know what, Jen, here's the deal. What's likely happening is not that your symptoms are coming back. You're going through drug withdrawal. And they didn't bother to explain to me that the symptoms of drug withdrawal are almost identical to the symptoms that placed me on that medication in the first place. And what is really sad is that not only was it, Jen, you should get back on and go back to the dose that you were at, but we might need to add something too, because look what happened when you stopped taking it. Things got really bad for you really quick. So, perhaps there's something we need to add as well. Oh my goodness. What can you do? Here's what you do. I will tell you that there are psychiatric and medical symptoms of withdrawal. I Googled withdrawal symptoms from antidepressants, and I find this document. It's not hard to find. Here you go. Look at this, everybody. Medical symptoms, psychiatric symptoms. There are both. This is a daily checklist that you go through that tells you exactly what you could be experiencing, from mood swings to headaches, okay? And everything in between. Things that mimic anxiety disorders, things that might mimic like the flu and like actual medical flu type like symptoms. This is what you do every single day, and you look at this list so that you know what symptoms you're having, and you can figure out whether or not it's actually part of withdrawal. And then guess what? If you start to have some of those symptoms, then you know your taper's going too quick. And then you slow it back a little bit. You dial it back. This girl right here is taking and quartering, and will soon have to start to sliver my Lexapro with a pill splitter because of how I'm being impacted by the withdrawal. And I don't want symptoms. When I talk to clients about going off of their medications, and they tell me the symptoms that they have, and days and days of like zaps, or feeling super fatiguey, or have gastro issues so terribly, why do we do that? It doesn't have to be that way. Low and slow is the way to go for most people. So I'm going to go back to the original piece of where I started on my soapbox here about tenacity. I am tenacious. And this is something I'm passionate about, because I have waited and tried for over 20 years to do this different. And now I am, and I'm here to tell you that it works. And so anytime you see a provider and your provider tells you, let's just half your medication, and we'll do that for a little bit. And then after, a week or two, then we're going to quarter it. And then after that, for a week or two, you come back, and then we're going to go off of it. That whole time, what is not said to people is, and if you have one symptom, just one, then we have too much and we got to dial it back. In fact, what the discussion often is you're going to have some of these symptoms. They usually last a handful of days, and then it'll slow down. Why do we do that to ourselves? Why? Find your tenacity today, people. And if you want more information on this, or you're interested in what I'm going through, just keep following me.